So welcome everyone. Good morning, good afternoon, and good evening. I'm delighted that you're joining us for Moving the Needle on Self-Care through application of the SBC Self-Care Framework. I'll ask as you come in if you can please mute yourself. We've set up this webinar such that people will be able to unmute and speak, and also you'll be able to connect with each other in small breakout rooms at the end of the session. If someone is not muted, we will mute you as we go if you're not speaking, so just a heads up, but please mute if you can. I welcome you all. I'm the moderator for our session today. My name is Andrea Ferrand, and I'm the Social and Behavior Change Senior Advisor at Population Services International, or PSI. I'll be your moderator and co-host alongside Heather Hancock, who is a Senior Program Officer at Johns Hopkins Center for Communication Programs. And we'll be your hosts for this interactive and important discussion on the role of social and behavior change in self-care spaces today. I'd like to thank and also introduce Kate Starr, who is our producer, and she's doing everything behind the scenes to make sure that this is a seamless event. We have people from over 60 countries joining us, registered and joining us for the event today. So please, we welcome you to introduce yourselves in the chat box by entering your name, your affiliation, country of residence, and if you'd like, share why you joined us today. We'd love to hear from you in the chat box throughout the meeting. We'll be displaying the slides in English on the screen. In order to access the slides in French or Spanish and follow along in those languages, click on the link in the box to access the slides in those languages. So at the bottom of your screen in the toolbar, you'll click on the button labeled Interpretations, and then choose which language you'd like to hear the event delivered in. We have both English, French, or Spanish interpretation. You'll then be added to the audio channel of your choice. And you can always go back and forth between channels if you'd like. Before we begin, I'd love to go over just a few ground rules. Please do keep yourself on mute while we're talking today. Please participate. We'd love to hear your thoughts. We'd love for this to be an interactive session and be as useful to you as it can be. Please share your thoughts, your views, and your questions in the chat box, and take care to be respectful of others' opinions, building and elevating ideas as opposed to any other option. And this is a space where all ideas and inputs are welcome. I'll walk you through our agenda today. We have a really exciting lineup. We'll welcome Sarah Onyango, who will share an overview of the Self-Care Trailblazers Group. We'll then follow with an overview of the WHO self-care guideline, and we will connect that to the Social and Behavior Change Self-Care Framework, which we'll focus on today. Heather Hancock will provide an overview of the framework itself and walk us through the various components and what may be useful there. We'll then hear from Discovering Innovations in Self-Care Project Director to share a use case of how the framework has been used in practice. And then we'll provide an interactive forum for you to select into small rooms to have discussions and take a brief practice at actually applying the framework to a case study scenario. And we'll close briefly. We hope that we'll close with a few report outs from your breakout rooms, and then we'll go on with the rest of our days. Now I'll hand it over to Sarah Onyango. Sarah is a senior technical expert and director of the Self-Care Trailblazers Group. And Sarah will share more about the Self-Care Trailblazers mission and vision and how these relate to the creation of the SBC Self-Care Framework. Over to you, Sarah.
Oops. Thank you very much, Heather. Andrea, I'm sorry. And I just want to take this opportunity to really thank Andrea and Heather for leading the work of advancing the SBC framework and for being behind putting together this webinar. So as has been said, my name is Sarah Onyango. I work for PSI as a senior technical advisor for self-care and also as a project director for the Self-Care Trailblazer Group. I'm based in Nairobi, Kenya. So I want to just briefly give you an overview of the SCTG, really briefly. The Self-Care Trailblazer Group, we commonly refer to it as the SCTG, was established in 2018 with funding from Hewlett and SIF. The mission of the SCTG is it's a global coalition that's dedicated to expanding safe and effective practice of self-care so that individuals better manage their own health, so that health outcomes are improved and health systems are better equipped to achieve universal health coverage. So we see self-care as a really critical part of achieving UHC. Our vision is a world where the practice of self-care leads to a more inclusive, equitable, and people-centered approach to optimizing health and well-being. And I think I've highlighted those words, inclusive, equitable, and people-centered. We really work to ensure that we are reaching, that through self-care, we're able to reach marginalized groups and ensure that all are included in accessing health and therefore achieving universal health care. Yeah, next slide, please. So when the SCTG was established in 2018, we had only about 50 members at inception, and now we have well over 600 members. So we're really proud of that achievement. Of these members, about 50% are individual members, and about 50% are affiliated to an organization. Currently, we have over 250 member organizations from 92 countries around the world. So we're really global, trying to reach all the corners of the globe. But more importantly, we try to reach as many members as possible from the global south, and currently have more than 60% of our members coming from the global south. The SCTG has representation from a wide variety of stakeholders, including advocates, SRH advocates, self-care advocates, academic and research institutions. We have donors, we have ministries of health, we have implementers, youth, and the private sector. So overall, our goal has been to really build a strong movement that is diverse in representation, but that also has strong voices from the global south. And we are seeing our progress in achieving those goals. Next slide, please. So this slide, I put it here to just give you a feel of how the SCTG works. So the SCTG has kind of two operations. It operates as a coalition on the one hand, and then we have a set of program activities that are implemented by the SCTG. So on the coalition side, the coalition is led by the Coalition Steering Committee. The Coalition Steering Committee is made up of volunteer members from among the membership who provide leadership and guidance for the SCTG. Members can engage in different working groups, both to learn, but also to contribute to the work of those groups. So we have the Evidence and Learning Working Group. I'll provide a bit more detail about it. The Evidence and Learning Working Group, as the name suggests, aims to promote evidence and learning, and is really behind what we have today, the peer learning community for SBCC. We also have a Global Advocacy and Communications Working Group that aims to create visibility and advocate for self-care at the global level with the UN agencies, with FP 2030 and other global platforms. And then finally, we have the Country Advocacy Working Group. And the Country Advocacy Working Group brings our country initiatives together to share experiences in advocacy at the country level and how that can inform the institutionalization of the WHO guidelines for self-care. In addition to that, we have what we call the SETG Learning Lab. It's a platform for sharing learnings on self-care. And last year, we had a very successful event, the Self-Care Learning and Discovery Series, where we had over 16 sessions bringing together diverse areas of self-care and organizations to share learnings on self-care. And that work has been captured in a publication that you can find on our website. On the program side, most of our work is led by the National Self-Care Networks. The National Self-Care Networks are local organizations at country level that we engage to steer advocacy at a country level and work with ministries of health to develop national self-care guidelines. We're currently working in 4 countries. We're currently working in Uganda, Senegal, Nigeria, and Kenya, and hope to start work in Ethiopia before the end of the year. So in these countries, we've worked through technical working groups or expert groups to bring together stakeholders, including the ministries of health, to develop guidelines or review existing policies so that they are conducive to the provision of self-care. And we have made good progress in many of those countries. The work of the National Self-Care Networks is brought together under the auspices of the Program Advisory Committee that monitors our implementation and ensures that we're delivering on our strategy. And then last but not least, we have the SETG Secretariat that has there's currently 6 individuals working in the Secretariat. The Secretariat provides the overall administrative support for the programming. So that's really how the SETG works. So all the different elements contribute to our performance. And as you can see, member involvement and engagement is really critical in how we work. Yeah. So next slide, please. So we had the SETG is committed to deliver on 5 key areas, and I'll just quickly go through them. The first outcome is really to build a movement. So that's the membership, a coordinated, diverse movement to advance self-care. Our second outcome is around awareness. So building support for self-care. So it's creating awareness about self-care, mobilizing support at the country level and also at the global level. Our third outcome is around developing policies and supporting the policies and guidance to help implement self-care and looking for financing for that. And a lot of this work is done by our national self-care networks or under their leadership at the country level. And then building on all these 3, we aim to increase demand and accountability for self-care among our target communities. And so we have carried out some work, including through the GEF, to mobilize support for self-care at the country level and to demand accountability from the ministries of health. Last but not least, the Secretariat is currently hosted at PSI, and the aim is for us to move this to an institution in the Global South. So that's a work in progress, and we'll have that happening in the coming year or so. Next slide, please. I just wanted to show some of the work that the ELWIG does, the Evidence Learning and Working Group that is behind the webinar we have today. So we have really 4 main objectives. One is to cultivate strategic leadership, and the work of ELWIG is led by the ELWIG leadership team that comprises volunteers and staff from the Secretariat. So we encourage members to be part of the leadership team and to inform the decisions of ELWIG. We're also working towards curating dynamic learning opportunities, including the one that we're going to have today. But we engage members, we partner with members to develop webinars, and we also develop tools that members can use to advance self-care. The third objective, which I think is really one of our biggest objectives, is really to design and execute impactful work streams. The work streams are informed by the needs of the members, and so far we've worked on 3 key work streams. One, to develop self-care policy mapping, on quality of care framework, and the SBC framework. So all these are already out there and are available on our website and are being used by countries differently. So we want to strive to create awareness about these tools and ensure that they support our programming for self-care. We're currently working on 3 work streams. One, looking at measurement of self-care. So this is a work in progress, has been going on for more than a year. So we're looking at the different angles of measuring self-care. The second work stream we have is looking at evidence mapping and prioritization that will support our programming going forward. And then last but not least, we are working on costing and financing of self-care, which is critical because we want to be able to provide evidence to countries that self-care is cost effective. So the peer learning community that I've mentioned already is our first approach at engaging with members more to help them understand the tools we've developed and to translate those into practice. And then last but not least, we are committed to creating visibility and impact of the work we do. We do this through participating in conferences. So we are looking forward to being very active at the ICFP, at SBCC conference, and others. And we have updated our website, so there's a lot of information about the work that we're doing and the tools that we've developed. I'll put a link to the site on the chat. And yeah, so that's all I have for now. Thank you very much. And if you have any questions, feel free to share them on the chat or yeah, any other way.
Excellent. Thank you so much, Sarah. It's such a delight to hear from you as the leader of the Self-Care Trailblazers Group and to hear about all the work being done by coalition members. Next, we're going to play a video from the WHO to frame our webinar about self-care interventions for health. Heather will put the link in the chat to the video, and she will play the video for us just now.
Ensuring the right to health requires a fundamental transformation in our health systems. The World Health Organization recommends self-care interventions for every country and economic setting as a critical path to primary health care and as a way to reach universal health coverage.
Devices, digital health, drugs, and diagnostics continue to evolve so rapidly that people have new ways of accessing their healthcare.
I look at self-care as a revolutionary approach, especially that it brings the sense of taking services closer to the community.
There is now a shift in the way we are beginning to manage health.
Self-care does not replace the healthcare system. It is the ability of individuals, families, and communities to promote and maintain health, prevent disease, and cope with illness with or without the support of a healthcare provider. Self-care shifts the focus away from a responsive approach towards a more integrated approach, which strengthens links between primary healthcare and communities and considers the holistic needs of a person. Self-care supports key principles of human rights and gender equality. In 2019, the WHO published guidelines on self-care interventions for health, with a focus for this volume on sexual and reproductive health and rights.
Là, le self-care est arrivé. Pour nous, franchement, les travailleurs dans le terrain, c'est une bouffée d'oxygène. C'est-à-dire qu'on va répondre aux besoins spécifiques de cette population.
The guidelines address different areas that empower individuals to prevent, test for, and treat disease themselves in a safe and supportive environment. This includes supportive laws and policies, health financing, regulated quality products and interventions, and education.
In as much as communicating with the community is concerned, we use the language they can understand, and then we try and have a face they can relate with. as opposed to the white jacket and scrubs.
When there are effective, integrated health systems and supportive legal frameworks, self-care can offer new possibilities.
Muchos ginecólogos, psicólogas, parteras, enfermeras se juntaron a tener una relación médico-paciente más horizontal y salir un poco del modelo hegemónico y darle herramientas a la mujer para que ella pudiera tomar sus propias decisiones.
The self-care work is the first line of defense on all health-related issues.
When individuals are given the opportunity to become active agents in their health, not merely passive recipients of health services, their health outcomes improve. Self-care can pave the way towards universal health coverage and a world where everyone is able to realize their right to health.
Excellent. So to set the stage for today's conversation on the SBC Self-Care Framework, I'd like to introduce Kabir Singh, who will give us an overview of the WHO guideline on self-care interventions for health and well-being. Kabir has worked in the area of sexual and reproductive health and rights for over 20 years, which includes consulting and staff roles at national, regional, and global level with various UN agencies across different geographies. Kabir has also served as executive director of a regional sexual reproductive health and rights advocacy network in Asia Pacific, and has worked on HIV SRH integration at the regional level with International Planned Parenthood Federation. As a consultant with the WHO headquarters, Kabir provides technical support to select countries in Africa to fast-track self-care interventions today. He's based in Nairobi, Kenya. I'll turn it over to you, Kabir.
Thanks so much, Andrea, for the introduction. It's wonderful to have the opportunity to present during this webinar, but also to see so many familiar names attending. I hope to be able to engage with many of you that I have not had the opportunity to work with before. Before I begin, I just wanted to clarify that the video you saw is a few years old, so it makes reference to an older version of the self-care guideline. But what you see on the screen now is the most updated version from 2022. So I just wanted to clarify that. Next, please. So in today's presentation, we will review the terminology of self-care to make sure we're on the same page. We will examine self-care in the context of health systems and also look at WHO's conceptual framework on self-care interventions. We will also have an overview of the guideline. And finally, I'll share some reflections to consider in our work on SBC in the context of self-care, as well as some key resources should you want more information. Next, please. Now, I won't repeat the definition that we heard in the video, but it is important to mention that the scope of self-care in the guideline includes health promotion, disease prevention and control, self-medication, giving care to dependent people, seeking hospital, specialist, or primary care whenever needed, but also rehabilitation, including palliative care. Now, self-care interventions, on the other hand, are tools that support self-care. These include evidence-based high-quality drugs, devices, but also diagnostics and/or digital interventions that can be provided fully or partially outside the formal health services system and be used with or without a health worker. Next, please. Now, this image shows self-care in the context of interventions linked to health systems. WHO's approach to self-care is very much a health systems approach, which means that self-care is not about handing over responsibility to individuals, but to actually connect them with links that exist within the health system, and also to support health systems with what more they need to be able to enable and sustain self-care. For example, let's think of a person who can pick up an HIV self-test from a pharmacy. Should they test positive, what is it that they need support with in coming back to the health system? to be able to understand what the test means for them, but also their partner or family. They will need access to ARVs, but also the information on how to be able to manage their own sexual and reproductive health needs and rights, but also their partners. Self-care interventions include self-management, self-testing, and self-awareness. While self-management could include...
Shabir, you muted yourself.
Sorry, when did you lose me?
Just 1 second ago. You can continue on from where you were.
So sorry. Self-care interventions, as I mentioned, include self-management, self-testing, and self-awareness. And while I mentioned that self-management includes self-injectables for contraception, self-testing could include home pregnancy tests, HPV self-sampling, and self-awareness covers all aspects relating to self-help, self-education, and self-regulation. Next, please. Thank you. This is the conceptual framework for self-care that provides all of us with a starting point for tackling this very evolving field of self-care. This framework illustrates core elements from both the people-centered and the health systems approaches, which are key to be able to support the introduction, the uptake, but also the scale-up of self-care interventions. The self-care guideline is grounded in and also advocates for a strengthened, comprehensive, people-centered approach to health and well-being, including for sexual reproductive health and rights. You can see the people-centeredness mentioned in the center in green. This approach is underpinned by some key principles: human rights, ethics, gender equality, which you can see in the pink circle. Now, if self-care is to be truly truly people-centered, we have to take a holistic approach to the care of each person. We have to take into account their individual circumstances, their needs, their desires, not just at one point in time, but across the whole life course, and of course, the environment in which they live. Now, self-care interventions need to be situated in safe and supportive environments. Please look at the red ring to enable an increase in people's active participation in their own health, including for patient engagement, but also if we are to facilitate access to and the uptake of products and interventions that can improve the health and well-being of the most underserved and marginalized populations. The framework also acknowledges the various places of access for self-care interventions, which you can see in what I think is mustard color, and the critical need for accountability by a range of actors that you see in the last ring in blue. So how does social behavior change fit in with the self-care framework? SBC can be applied across all these levels of the WHO framework, which Heather will probably talk more about in her presentation. But one example is the role that it can play in developing supportive social and gender norms for self-care that intersect across education, health literacy, information, and the protection from violence, which you can see in the enabling environment level. I think SBC can also be valuable at the level of accountability, particularly if you look at its linkages to social accountability programming. But there may, of course, be others as well. Next, please. Now, this is an overview of the guideline. We don't have too much time to go into specifics, but the guideline is very much a living guideline. And what that means is that we will keep updating it and expanding its scope with new evidence as new evidence becomes available, and also depending on progress with policies and programs. The best way for everyone to stay updated is via the Magic app. That is a live document that will always have the most updated version. The link will be shared in my last slide. The primary target audience for this guideline is national and international policymakers, researchers, program managers, health workers, donors, civil society organizations that are responsible for making decisions relating to self-care, including the delivery and promotion of self-care. Many of you are in the room today. As of September 1st, this year, the guideline now has 46 recommendations across a range of topics, ranging from family planning to antenatal, intrapartum, and postpartum care, safe abortion, sexual health, communicable diseases, but also non-communicable diseases, among others. The guideline also has good practice statements, 18 of them, which cover key programmatic, operational, and service delivery issues that need to be addressed to promote and increase access and uptake. Since there's limited time, I will move, if that's okay with colleagues, maybe if we could move forward to the points to ponder. Thank you very much. Context is everything when we talk about self-care. Let's talk about this from a point of the 5 Ws and 1 H. Are we on the same page when we talk about self-care? But also, our understanding and experience of health and well-being is situated within diverse sociocultural, economic, and spiritual contexts. Think of the social determinants of health. Why do people choose to initiate and sustain or reject self-care may also be different, and the pathways are complex. But again, we must look at it from the point of view of the key principles. For example, what does individual health literacy, motivation, agency mean for someone living with HIV who experience stigma and discrimination not only from the community, but also the health system? We look at the when. Self-care may be practiced across the life course in fragile and humanitarian contexts, but can also change in personal situations. Where is it practiced? Self-care may be experienced across geographies and diverse health system environments. Who initiates self-care? Not just able-bodied people, but also people with special needs. A self-carer, let's not forget, can also become a caregiver and vice versa. How we experience self-care, again, can be different. Think of the key principles, but also our engagement with the health system has a bearing on that. Let's talk about capacity. This isn't capacity of just the individual, for example, health literacy, but also the capacity of the health system and the policy landscape equally to enable self-care across the life course. We have costs and convenience. There may be many financial, but also non-financial costs relating to self-care being initiated and sustaining it. Do we know what they are and how the individual's journey is affected? Connections are key. We must locate our efforts within the diverse experiences and understanding of connections, community, and collaboration with the health system, good or bad. And finally, communication. Are we speaking to them or with them in a language that we value and that they value and understand? And are we reaching them in spaces that they inhabit and trust? These are all some points for us to ponder as you work through the SBC framework to advance self-care for everyone, everywhere. I won't talk about the resources because that's something that will be shared and colleagues can access at their own time. Thanks, Andrea. I'm sorry if I went over.
No, you did great, Kabir. Thank you so much for being here. For those who have questions about the self-care guideline from the WHO, please, you're welcome to put them in the chat. Kabir can answer some questions in the chat. I'd like to turn it over now to Heather Hancock. Heather is a senior program officer at the Johns Hopkins Center for Communication Programs. Heather is a leader in social and behavior change globally and has been at the helm of convening the community around various SBC areas of practice, including the SBC Self-Care Framework and other communities like social and behavior change for service delivery and other ways where our community convenes and moves our discipline and our practice forward. I'll turn it over to Heather to walk through the SBC Self-Care Framework.
Thank you so much, Andrea. It's really great to be with everybody today, and we're happy to share this framework that we created together. The impetus for creating this SBC Self-Care Framework really came from our SBC for Service Delivery work, and there was a real desire to articulate and understand better how SBC can help to improve health outcomes generally, and particularly within the self-care efforts. And so as a group, we worked across several different countries and many different organizations to co-design this SBC Self-Care Framework so that we could better articulate that. The real purpose of the framework is to explicitly apply social and behavioral lens to sexual and reproductive self-care, and in particular to demonstrate the importance of incorporating SBC approaches into sexual and reproductive self-care initiatives. And we really wanted to help users understand what is driving self-care behavior and think about those behavioral aspects and those social aspects that are influencing self-care, and help users of this framework to be able to make programmatic and policy decisions to address those specific drivers. The framework has 4 different audiences, and you can see them listed here on this slide. The first is policymakers. The second is donors. The third is government representatives more generally. And the fourth is program implementers. And you can see on this slide that there are a few different things that we mentioned, ways that these different audiences may be able to use the framework itself. So for policymakers, it can help policymakers discuss what's driving self-care behavior and think about how they can address those drivers through policy efforts. It can also help them to include and fund SBC interventions more deliberately in their costed implementation plans and other guidelines for self-care. For donors, the self-care framework can really help them identify funding and advocacy gaps for SBC interventions, for self-care research and product development. For government representatives, the framework is something that can really help them identify the SBC needs in self-care delivery and interventions, and help them advocate for these national policies and guidelines, and also make some funding decisions and justify their expenditures on SBC. And finally, for program implementers, the framework can help them to identify the self-care behavioral determinants and more deliberately incorporate SBC approaches into self-care interventions, and really help them to think through what kind of formative research they may need to undertake as part of their programmatic efforts. There are some key principles that underline this whole framework. The first one is health equity as a value in self-care, and really looking at self-care as a way to achieve greater health equity. And the second principle is focusing on social determinants of health, and really understanding that those social determinants of health must be addressed alongside behavioral determinants. So we need to think about poverty and education level and where people live as things that will determine whether someone can actually adopt and maintain use of self-care practices. The third one is something that Kabir brought out in his presentation, and that is that individuals who are practicing self-care or using self-care products really need a supportive system to practice self-care. Even though we're talking about self-care, which is really focused on the individual, we really find that self-care needs to happen within the larger system. And so we need to think about that system and how that can support individuals to practice self-care. And then finally, we'll talk a little bit more about these later on in the presentation. But as part of our research process and our co-design process, we really started to see that there were 3 key cross-cutting behavioral determinants that are really relevant broadly. And those are health literacy, motivation, and agency and power. And again, we'll talk about those a little bit more as we move forward. This is our SBC Self-Care Framework. I recognize that it's you can't see the whole thing right now, but you will have a chance to really dig into this and understand it better. And I'm going to talk through several of the elements of this self-care framework so that you can start to get a sense of what this actually looks like. There are some theoretical underpinnings for this framework, and the first one is the stages of change, which I'm sure many of you are familiar with. But essentially, what we saw as important as part of our desk review process and working with various self-care and SBC experts through the co-design process was that we really need to look at self-care and what is influencing self-care through a stages of change. And so you can see how an individual can move from awareness of self-care products and practices to making the decision to actually undertake some self-care practice, then to initiating that practice or using some of the products, and then to continue using those products or practices, and then to championing those products to other people and helping to other people to adopt self-care practices or use self-care products. And of course, as with anything related to behavior change, this process is not linear. People may skip back and forth between stages. They may drop off at some stage. So it's not necessarily the case that they will go through all of those stages, but generally it is helpful for us to look at the journey that an individual takes toward adopting and maintaining use of self-care practices. And again, emphasizing the need for support at each of those stages in order for individuals to start using or practicing self-care to continue using that. So there is a need for general support across all of those stages. The second theoretical underpinning is the socio-ecological model. We all know that that an individual is grounded in a complex system. There are lots of different people and factors who are influencing an individual's behavior. And so we really need to understand self-care behavior within that context. So we look at all of the levels from individual and interpersonal and the community level, which is hugely important, to the health system, and then the larger societal levels. And we need to understand what is influencing that self-care practice within each of those levels. And again, through our process of designing this framework, several key actors came out as being particularly important. These are not the only actors who are important in an individual's practice of self-care, but in particular, we found that partners and family have a huge influence on an individual. Friends and other social influencers also have a large influence. Providers themselves, especially with introducing or helping make linkages to the health system, and then policymakers. And so you will see in the framework how each of those have a potential to influence self-care behavior. And then you can look into this more a little bit in detail on the framework itself, but we do see some key areas where SBC has a role to play in supporting self-care behavior among each of these different audiences that I just mentioned. And I won't go through all of these, but for example, at the policymaker level, SBC can really help to advocate for self-care funding and supportive policies. At the provider level, it can really be used to help cultivate trust with clients and foster more positive attitudes and norms among the providers themselves. Among friends and social influencers, it can really help to set more supportive self-care norms and nurture that health literacy among friends, who then can communicate that also to individuals who may be interested in adopting self-care. Among partners, it can encourage greater dialogue and address gender and power dynamics, and it can also help build self-care knowledge and skills. And then finally, at the individual level, the individual self-care, it can really help to cultivate that sense of self-efficacy, spark their motivation, and develop more positive self-care attitudes. So these are just a few highlights of where SBC can play a role in supporting self-care behavior. Alongside the self-care framework itself, we have a few different graphics that really help people to understand who are the core actors influencing self-care at each of those stages. And then we also have another graphic which I understand is there's a lot here, which helps to highlight the behavioral determinants by stage. So the awareness, decision, initiation, continuation, champion stage, and also by actor. So looking at the individual, the partners, and the friends and social influencers, and the policymakers at each of those levels. As I mentioned earlier, we do see that there are some cross-cutting behavioral determinants of self-care. One of those is health literacy, and the health literacy factor really helps the individual to understand their own health, their body, the needs that they have, the options that are available to them. So that's really critical to laying the groundwork of being able to practice self-care. That health literacy also can motivate their own self-belief and being able to practice self-care, their confidence in doing so, and their self-advocacy to say, I want to and I can do this. Motivation is another really important cross-cutting determinant. There has to be that desire. They have to see the benefits of practicing self-care, and it has to be relevant to them in their particular stage of life. And then it also is influenced by the barriers that they face, the hassles that they perceive, and any negative aspects. And then finally, agency and power are huge contributors to whether someone practices self-care, including the decision-making autonomy that an individual has, the support that they perceive that they have from those around them, and their feeling of control over their own lives and their situations. And finally, that agency also influences the skills that they have and the confidence in their own abilities. So just to pull out a few quick ones, because that graphic that I showed you earlier with behavioral determinants is really big. And so just a few things at the actor level for the policymakers. Some of the behavioral determinants are things like whether they have, there's training and qualified distribution outlets for self-care products, the types of policies that exist, and the guidelines and considerations of equity. Among providers, some of the behavioral determinants include what kind of skills they have, the knowledge and experience with self-care, their own personal beliefs and their attitudes, and perhaps fear of retribution, and whether they feel that there's any sort of conflict of interest with, encouraging people to engage in self-care. At the friends and social influencers level, we see a lot of role of norms and sanctions and stigma. We see that friends often can provide support, whether emotional support or even financial support sometimes for friends to start practicing self-care. At the partner level, the partner's beliefs and attitudes and the power dynamics between partners will really play a role, as well as the amount and quality of information that a partner has if their partner is interested in engaging in self-care. And then finally, at the individual level, we see their past experience really plays a role, knowledge and skills and self-efficacy. So you can start to see that there are a lot of different factors influencing this behavior, and that we need to really look across the system. So finally, as I wrap up here, I just wanted to share some sample determinants. And again, I recognize that this is small, but this is at the initiation stage. And you can start to see at each of these levels the kinds of things that might influence whether someone initiates use of a self-care product or some sort of practice within self-care. So with an individual, how comfortable do they feel with their own body and doing certain things with their body that they may not be used to or comfortable with? What kind of perceived social support do they have? At the partner level, thinking about, does the partner trust their partner's ability to use self-care? Do they have training and knowledge? What's their perception about the risk of using this certain kind of self-care practice? At the friends and social level here, we see that there may be willingness of friends to accompany or assist them during their first use. Or, for example, their friends' level of knowledge and training to support initiation. And so you can see at each of these levels that there are many things that we may want to consider and think about as we design and implement and evaluate self-care activities. And SBC has a role to play in addressing those behavioral determinants. So I will pass it back to Andrea to wrap up our presentations. Thank you.
Thank you so much, Heather. It's really helpful to walk through the SBC Self-Care Framework and just get a taste for all that's in there. We're going to turn next to a use case presentation of one of our colleagues, Abby Winskill. We really wanted to highlight an example of the framework in use and in action. So Abigail Winskill's joined us. Abby is the project director for Delivering Innovation in Self-Care, or DISC, at PSI. Abby has 15 years of experience in marketing and behavior change, working across commercial and nonprofit sectors. She started her career at Unilever, developing innovation and consumer marketing for iconic brands like Tresemme, hair products, and Lipton. Abby transitioned to Population Services International, where she's supported many project teams to apply marketing, user-centered design, and market-based approaches to program design. Currently, Abby is the director for the DISC project, which is accelerating uptake of self-inject contraceptive in Uganda and Nigeria through addressing consumer and provider barriers. Abby, I'll turn it over to you.
Thank you very much, Andrea, and it's wonderful to be here today, and I'm excited to demonstrate a real tangible example of how the SBC self-care framework gets applied in reality. So as Andrea said, DISC, Delivering Innovation in Self-Care, is really a 5-year funded project by SIF, focused on bending the curve for uptake of self-injectable, really focused on addressing behavioral barriers amongst consumers and providers. Next slide, please. And so we're really focused, as I said, on thinking about the consumer behavior, and our primary focus was really on unlocking demand. And so there are actually 2 main interventions that we have that I'm going to talk through and how those apply to the framework. The first one is what we call a behavior change ecosystem. So that is really thinking about how we go to women, reach them where they're at with communications, information, and support throughout their entire self-care journey, thinking about how they can find out about self-injection, access the training, and then continue using the product. And then the second intervention is really zooming into that client and provider interaction, which we dub the moment of truth, at the point where the provider is training the woman on self-injection, and really optimizing that and making sure that that is really frictionless. And I'll talk through how we've done that in a second. Next slide, please. So let's start with the behavior change ecosystem. So really just to link this very closely to the SBC Self-Care Framework. So the key areas where this focuses in on is firstly around empowering women to access and practice self-care. So not having the provider as a barrier, but really going to the women with this information. Supporting positive social norms, including male support and in particular couples communication. And demonstrating confidence in women's agency and ability to self-inject. And so if you go to the next slide, I'll talk through how we've achieved those through this. So our campaign, if you like, is Discover Your Power, which we see as this rallying cry, which we deliver across a range of different channels, from radio, TV, digital and social media, advocacy amongst peers, and community outreach and events. And this is really about providing women with inspiration from trusted sources, whether that's peers or other trusted sources of information, making sure they have that information at their fingertips where they are, and then supporting them, linking them to training so they have the support to take up the product. That's what we've created in both of these markets. And just if we go to the next slide, please, talk about our principles by which we have developed our creative assets and our communications and tactics through these channels in this ecosystem. So the first one is about going to the consumer with information. The provider is a very important source of information, a credible source of information, but also we don't want the provider to be the only gatekeeper, particularly when there are biases against who they believe is actually eligible or allowed or it's feasible for them to self-inject. So we're really going to the consumer with that information so they can make the decision about whether this product is right for them. Secondly, proactively overcoming the barriers around lack of agency, then fear of pain, really tackling those head on in our communications. Thirdly is creating relevance of self-injection and self-care, and doing that through creating longer term engagement. This isn't a snap decision that people make, so you need to have that longer term ongoing engagement. And finally, tapping into peer advocacy, so peer-to-peer networks to normalize that self-inject behavior and drive that word of mouth. Next slide, please. So that's one side. The second intervention then is what we call the moment of truth. And this is then really focused on the provider behavior change. And the specific areas of the framework that this connects to is firstly, trusting clients' ability to self-inject. Secondly, being available and willing to patiently address clients' concerns. And thirdly, encouraging experiential learning. So I'll talk a little bit about how this really comes to life in our moment of truth work. Next slide, please. So what we identified was that while we were doing all of this demand generation and provider training, there was a really leaky bucket where when women actually were trained on self-injection by a provider, there was still a large proportion of those women who were opting out of self-injection. So even having gone through the training, they were not then choosing self-injection. And some research conducted by Path and our own research demonstrated that a large proportion of the reason for this was this fear of needles. And this comes to life in two areas. One is the fear of pain, but also this lack of self-efficacy and lack of agency, that there's this perception that only providers can inject. And so what we did was to create an empathy-based training module that sits alongside the regular self-inject training. But this one would really focus on increasing providers' confidence and capacity to coach women. So help them and actually help women to overcome these fears and therefore opt for self-injection. And I'll talk a little bit on the next slide about what that looked like in practice. So this one-day training has a few key components. The first one is really explaining to the providers that clients will have these fears. These are real fears that many women have. And then explain that it's their role and provide messaging that the providers can use to help overcome those barriers. And then there's a lot of role play and practicum, really giving them the opportunity to practice their coaching with real clients and learn from their peers as well. And so this one-day training is an add-on to the National Self-Injection Training Curriculum, which with that really focuses on the technical aspects, and then ours focuses more on that empathetic coaching. Next slide, please. So in order to test this, we tested this in a set of innovation sites in both Uganda and Nigeria, and we tested what we called the conversion rate. So this is the proportion of women who voluntarily opt for self-injection after having been trained. And we achieved around a 69% average across public and private sectors. And that does outperform the global benchmarks. And what's even stronger is that we were able to sustain that 6 months beyond the intervention as well. So we are seeing that empathetic counseling is continuing to work well for providers and for clients. And if we go on to the next slide, we also looked a little bit at provider confidence. We did qualitative interviews before the training. We then did it immediately after, and then after a bit of supportive supervision. And you can see that the blue bar is the very confident, and the confident lines are growing in terms of providers' confidence to really train but also coach women in self-injection. Next slide. So those are our two interventions. They're a whistle-stop tour of our interventions. There's a lot more behind it, and I'm happy to answer questions. These are just showing how they really connect to the SBC Self-Care Framework, and you can see how those different drivers that Heather talked us through come to life in our interventions. Just a few sort of further learning opportunities where we see that the SBC framework could be used as a tool further is, and this is specific to self-care and self-injection, but one is being able to we know that anecdotally that self-injection creates this boost in confidence from a woman's perspective, because she sort of feels very proud that she can do it herself. And so, but more exploration of the relationship with empowerment, and whether that sort of increases empowerment levels over time is one area. We believe more investment is required in driving engagement of men and couples communication, as we know that that kind of joint decision-making relational power is a really big factor on women's choices. And then thirdly, as I think many of us are aware, that the value proposition of self-inject for the private sector still remains uncertain, particularly when there's supply commodity challenges. And so again, that's another area of exploration. I will hand back. Thank you, Andrea.
Thank you, Abby. It's so interesting to hear about your work, and also how the framework can be connected to your existing work and how it might be used in future. We have a question in the chat about whether you measured switch rates between DMPA-IM to self-inject or subcutaneous, and vice versa, or other methods.
We have done. We're tracking the proportion of DMPA-SC that is self-injected. We haven't been as focused on DMPA-IM to SC. It is something we can look at, but we've mostly been focused on how we're converting DMPA-SC to self-inject as opposed to provider-administered behaviors.
Wonderful. And Abby, we have another question from Kumbirai. Did you experience resistance from providers themselves who think that self-care may be taking away their work or threatening their jobs? Can you talk a bit more about that?
Absolutely. So in the public sector, there's a big difference between the public sector and the private sector. In the public sector, there is more of an awareness that, you know, if women are trained to self-inject, that they then won't need to come back to the facility as often. And therefore they see the value in that, especially when FP is a small proportion of everybody they see. Private sector, that's where the challenge is more, and we need to do more work related to that. Private sector is more difficult if you think you're going to lose a customer. And so we do see things like, you know, pricing being put to the cost of 4 visits, for example, or a consultancy fee to kind of cover that sort of lost custom. But there is a lot more that needs to be done for the private sector versus the public sector.
Thank you so much, Abby. I see we've come to the end of the questions in the chat for you. If folks have additional questions for Abby or any of the presenters, you're welcome to put them in the chat. If for some reason our presenters are not here, we will prepare a response to questions and share them back with the slides and the recording after the meeting. Thank you so much to all the presenters. We are now going to move forward, and we wanted to provide a space for those of you here and those of you who are interested to engage with each other and really engage with the SBC Self-Care Framework. It's a relatively new tool, and as we know with tools, we want to provide opportunities to engage with it and work with it to help you keep it top of mind and really know what's in there for when it may be useful to you in your own work. So we have a small group work that is prepared and available for you. What we would like you to do is, next slide, Heather. We're going to be using some case study and use case activity. So we've created breakout rooms, which you can select yourself into. And when you get into your breakout room, you'll read the use case scenario together as a group. Then you can review the SBC Self-Care Framework files and the slides that are available in the link that Heather shared. And we've provided just a simple table that walks through a few questions to help you think through your use case scenario and how you might use the framework in that case study. We'd love for you to respond to the questions in the table, in the document that you have, and really record your answers there so that we can collect some of your thoughts about how you'll use it. And in order to wrap up the activity, we'd like for you to come up with about a 1-minute pitch that summarizes your main points about how you would use the SBC Self-Care Framework in your scenario. So in order to facilitate this group work, Kate will make the breakout rooms available. You'll be able to select into your own breakout room, and we've named them according to the case study scenario that you'll be going into. So for example, there will be a formative research case study if you're a researcher interested in applying the framework for formative research. There's a program design case study. There's an advocacy and a policy case study. There's one case study and room for French speakers and one case study and room for Spanish speakers. We've translated the case study and the instructions for you so that you can work through that on your own. And for those who speak Spanish or French, you're welcome to join those rooms. And we have a link here that I'd like everybody to click into. So Heather's just put the group work links to the case studies in the chat. So if everybody can click into that Google Doc, that will give you a link for each of the different breakout rooms, room 1, group 2, group 3. And Kate will now open the breakout rooms. In order to choose a breakout room, you will go down to the menu at the bottom of your screen where it has your mute and video button, the participant button. On the right-hand side, you should see breakout rooms. If you don't see breakout rooms, you'll have 3 dots and a selection option to pick more, and then you'll see breakout rooms there. When you click on the breakout rooms, you can see the different rooms. There is formative research, policy, implementation as a self-care or a provider, and you have the option to click a blue button to join that room. So I welcome you now to join a room. Go into that room and you will work using the links to the case studies in the Google Doc that Heather shared to facilitate your discussion. And we'll pop around to the different rooms. If you get stuck, if you have any questions or you're not sure how to proceed, we'll pop into the rooms and support you through that. And finally, if any of the rooms is a little bit too full, we might move you out, but let's see, we don't have anybody joining rooms yet. So as you move into your rooms, we will right size to make sure that you have appropriate amount of people for discussion. So please now select yourself into a breakout room and make sure to click on the Google Doc link to help you facilitate your activity. Who wants to talk about what component of the framework or how they might use the framework for their scenario? What kind of person wants to help me as a facilitator? Yes, please. Thank you.
I'm going to jump in because it's a serendipity. I have the same case scenario right now in my work. So this is, the formative cases assessment is the same. We're about to work on a self-care study, project study in South Sudan, looking at the whole path to use of contraception, not just self-injection, but all the other methods as a mean of strengthening resilience. So this is excellent for me. And I am using the self-care framework to inform the areas of inquiries for the formative assessment. It's a human-centered design study. So a lot of that is going to be included in that. However, we don't have enough of a budget to cover all the different components in there. So, there's limited, we have to prioritize certain levels, and less on the other ones. Over.
Excellent. And the framework really is it's a great way to help think through some of the various levels or determinants or audiences, and also one that can help inform and support the prioritization of that. Thanks for sharing that, Christine. That's so helpful.
Andrea, maybe I could just jump in also to respond to that, Christine, that just because we take a systems view to self-care doesn't mean that one individual project needs to address all of those different levels or those different actors. As Andrea was saying, I think what we feel is important is that you look at it holistically and see that there is a need to address those different levels, but that's why partnerships are going to be so important, and seeing what other people are researching and building off of that as well, so that you can address things more holistically, but you can't do it alone, of course.
Correct.
Thank you. I see a hand raised. Sita, would you like to share?
Yeah, thank you. I was in group 3, but overall I felt that, because of the case study and the issues highlighted there, helped us go back to the framework and see which pieces we can pick up and then redesign. So it's not just looking at the framework and then trying to design, but I think it can work the other way around, that us as implementers, if we have a particular problematic situation, or we look at that situation, create the, a kind of a case scenario, and then go to the framework and see how we can rework the design.
Absolutely. It's a great tool, as you mentioned, Sita, for validation of your design, for further developing monitoring frameworks, and also, considering other aspects for vetting and validation. Colleagues, we've reached the end of our meeting time. I wanted to say thank you to all of our speakers for sharing their experience, for really sharing their expertise and the tools and various tools that we can use and apply for social and behavior change, and integrating behavioral lenses into self-care programs and policies. I'd like to thank all of you for joining us for an hour and a half, listening to our speakers, sharing your questions, sharing your reflections and your thoughts, and engaging with each other in this important dialogue. We know that you're busy and we appreciate your time. And finally, I'd really, really love to thank our interpretation team. They made all of this rich content available to a wider audience. And I thank those of you who joined us today and engaged with the interpreters so that we could extend and ensure inclusion and participation across languages and countries. So the power of the Self-Care Trailblazers Group is in its members, and I'd encourage you, those of you who aren't members yet, to consider signing up. We've dropped the site to learn more about membership and a form to be a member in the chat box. And this way you can hear more about our work in SBC for self-care and future activities across the range of self-care interventions and programs to keep this work moving forward. Thank you very much, all of you, for joining, and have a great rest of your day.